Yeah, go ahead.
What is the difference between oppositional defiance and a personality disorder?
What is the difference between oppositional defiance and a personality disorder? Personality disorder is one of the labels that psychiatry uses to describe people who have traits in their personality that causes them major problems. An individual's personality starts to form as a teenager, and that's when we see personality disorders start to form. They fit into a few big categories and have lots of different names, and we don't need to go into all of that now. I'll just kind of oversimplify. One group consists of people who are kind of strange and odd and different, and they keep to themselves a lot, and we'll call this cluster A. Another group consists of people who are overly dramatic. They have lots of mood swings. Seems like they're always getting into trouble, and we'll call this cluster B. These individuals are very difficult to get along with. Another group consists of people who are withdrawn, have a lot of anxiety, and they have to do things a certain way, and we'll call this cluster C. Now, when any of these problems screw up people's relationships, their ability to work, it gets them in trouble with the law, or it makes them miserable, then we call it a personality disorder. And studies have shown that children who have certain psychiatric problems are more likely to get personality disorders as adults. So children who have ODD, they're about 4 times more likely to have a personality disorder when they grow up, and that's about a 15% chance. And if they already have some signs of a personality disorder as a young teenager, then they're 25 times as likely to have a personality disorder as an adult. So what this tells us is that the longer these problems go on in childhood and as teenagers, the more likely they are to lead to personality disorders as adults. Now, there are 2 types of personality disorders that fall into cluster B, which are associated with ODD, oppositional defiant disorder, and conduct disorder. And these 2 that are associated with ODD are called borderline personality disorder and antisocial personality disorder. Females with ODD tend to graduate to borderline personality. Males with ODD tend to graduate to antisocial personality. Borderline personality disorder is called borderline because patients have many traits from different psychiatric disorders. For example, they have their mood is very unstable, like bipolar. They have strange experiences, like people with schizophrenia. Their relationships with others are usually quite unstable. They often don't have much of a sense of who they really are or where they're going in life, and they may cut on themselves with a razor blade or some other sharp instrument. So if an individual is a female and has ODD, then she has approximately a 15% chance of getting borderline personality disorder. Antisocial personality disorder is basically a continuation of conduct disorder. People with this problem, they continue to not respect the rights of others or their property. They continue to get into fights. They steal, cheat, lie. They're usually involved with legal difficulties. They also have an extremely high rate of substance abuse and suicide and other unnatural causes of death. So again, this is primarily a male diagnosis. Almost 20% of teenagers with ODD will have antisocial personality disorder as a result. I hope that answers your question, and I thank you. Thank you for your question.